Good afternoon. It's great to be here today, and I thank the university for asking the campaign to come and speak to you today. I have two goals in being here today. The first goal is to continue to familiarize myself with the federal legislation and to be able to work with the campaign and to again begin to develop policy and formulate things that we want to do if elected to address this legislation at the state level. And second of all, I have the goal of here to bring you comments from the campaign, from Governor Branstad and the campaign itself. I'd like to start out by talking about some of the positive aspects that Governor Branstad believes are part of the federal legislation. First of all, that insurance coverage cannot be denied because of pre-existing conditions. And that is a positive, he believes, a positive aspect of this legislation. He also believes that the improved reimbursement rates for the Iowa health care providers, again, is something that's, I know, as being a former legislator, is something that was always discussed and talked about, and it is a positive aspect of this legislation. But that being said, Governor Branstad does believe and would encourage the Attorney General to join the 20 other states in challenging some of the mandates that are involved in health care reform. And this, of course, our concern is primarily because of the significant new Medicaid costs on the states and the major changes in the state's authority to regulate private insurance. The new Medicaid coverage provisions in the health care legislation result in a huge expansion of the Medicaid rolls. Now, obviously, that's been a topic that's been mentioned several times today. The CMS projects that the national Medicaid enrollment in 2014 will be 30.4% higher than it currently is today. In Iowa, 22.3% higher increase of those enrolled. That translates to a cost in between 2014 and 2020 will be $187.7 million. This current year, we have our Medicaid funding is funded about $500 million with one-time funding. And when we add that on the fact that the FMAP extension is not guaranteed and looks likely that it won't be extended, it is a very real and daunting question for someone who is running for the governor of the state of Iowa and who will have to address the budget. And that is a very big concern to Governor Branstad in how do we pay for these very real increased Medicaid costs. The Branstad campaign is therefore disappointed with the passage of the legislation, but that's the cost set aside. It's more the policy things that are driven by the passage of the legislation. Problems such as crowd out, which is where individuals, of course, that are currently covered by private employer-sponsored coverage or individual coverage are under the income threshold and then will therefore move over to Medicaid. This is a particular concern to Iowa, where the insurance industry is very important, and we heard Susan Voss talk about the very critical point that these insurance companies are having to make that decision based on pure economics. When we have over 60,000 jobs in the state of Iowa provided by the insurance industry, that is a very real consideration. Another concern is in the legislation's requirement that the states increase the Medicaid reimbursement rate for primary care physicians to the same level as the Medicare rate, and a mandate that, to my understanding, is only going to be funded until 2015. At that time, it drops off, and again, another mandate that the state will pick up unless the federal government decides to do so. Another concern was mentioned earlier, the maintenance of effort requirement for Medicaid and Hawkeye program. Because the states risk losing federal funding if they make eligibility requirements more restrictive than the new federal legislation, they're left with only two other options: to cut the provider reimbursement rate or reduce benefits. And we know those rates were cut last year with a 10% across the board cut. So if the decision is made to cut provider reimbursements, the result is fewer doctors who choose to practice in the state of Iowa. And we just heard that as a real issue already especially in some specialty areas. Again, forcing patients to seek the help where they can, and that is the emergency rooms. So what options are available to our state to protect the citizens of Iowa from the adverse effects of this legislation? Well, Governor Branstad believes the plans need to begin now for legislation that would need to be drafted soon and in place by the legislative session in January. Iowa's best response to this legislation is determine our needs and priorities and adopt policies that increase health insurance choice, competition, and coverage, while also reducing costs. And the Governor Branstad, if elected, is looking forward to working with the legislature. One of the hallmarks of his executive experience over his 16-year tenure is working with all groups to come to a good consensus. And I believe that if elected, he would do that again. And we have many people in this room that would be able to do that for us. So we look forward to those common sense solutions and mitigating the costs of this legislation should it withstand the political and legal challenges it faces. Thank you for your time.